Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center. Really happy to come to you today from ASCO 2023 with Dr. Peter Forsyth, Chair of Neuro-Oncology. Thanks so much for being here with us today.
Thank you, Patrick. I really appreciate it. It's a great meeting.
Wonderful. So Dr. Forsyth, you're an expert in neuro-oncology that deals with malignancies in the brain, but also toxicities from therapy. So why don't you talk a little bit about that?
So we're giving a talk to talk about the neurotoxicity that you see with immunotherapies. The nervous system and brain is super sensitive to these agents sometimes. So we really need to be on top of them and recognize these syndromes. I was trained as a neurologist, but the neurology is extremely complex. So when people get these complications, they can involve multiple parts of your brain, your muscle, your nerves. It's fascinating to figure it out. And it's not like what we learned in medical school. These are like new diseases. So we need to do a good job in caring for patients, early identification, and prediction. And I think we're really lucky at Moffitt that there's a close collaboration with neurology, neuro-oncology, and all the medical oncology, so we can get called as soon as possible, because you have to intervene early to reverse it, and then things will be fine, but you really need to have experts working with you to deal with these. So I'm advertising for neurology consults as soon as possible.
That's great. Well, there are many different kinds of immunotherapy. So
Yeah,
I know
yeah,
cytokines
yeah.
can cause really a lot of issues. When you give intrathecal medicines, it can cause issues, but also certain CAR Ts can cause issues.
Yes.
So are all
And the
those
CAR
with different
Ts.
mechanisms and different ways to treat?
As far as you know, there are different mechanisms, and we really need to understand them. And they're very specific, as you said, for each particular immunotherapy. It teaches a lot about the nervous system, and I think the immune response in the nervous system. So it's super interesting, and it's a challenge. Every time there's a new therapy, we just need to be very vigilant about neurotoxicity, because it can be serious, and if it's not treated early and properly, irreversible. It's quite a challenge, but we look forward to it. It's very exciting. All the new agents here and at Moffitt, it's just amazing.
Great. Now let's switch to brain cancers. Anything new and exciting with brain cancers and glioblastoma here at ASCO?
Yeah, so there's a practice-changing study that's being announced in a few minutes, which is evositinib with a IDH1 inhibitor. And it was looking at patients with low-grade tumors. So these are mostly young patients with grade 2 tumors that have the mutation, the IDH1 or IDH2 mutation. And they used this drug in a large randomized study, 330 patients, 10 countries, led by Ingo Mellinghoff at Sloan Kettering. And they found significant differences in progression-free survival from 28 months, 11 months in the control group to 28 months. So that's like 2.5 times longer. It's really significant because most of these patients with the low-grade gliomas are young adults or adolescents. So this would be a really good way to delay other therapy that might have problems, and maybe some people can be on it for years. So it's a practice-changing discovery. And of course, it's just the beginning, because several companies have their own IDH1 inhibitors that are developing, and so we're going to learn how to use them in combination over the next several years. So that's a really big thing.
Well, exciting that we're getting progress
Yeah.
in brain tumors, as well as how to manage neurotoxicity of cancer agents. So thanks so much, Dr. Peter Forsyth, Chair of
Thank you, Patrick.
Neuro-Oncology at Moffitt Cancer Center.